Welcome to week 5, module 5. I'm going to share my screen here. So again, this is going to be a quick synthesis of the chapters in Giddens, and we are going to talk about chapter 1, which is the concept of development, chapter 3, concept of family dynamics, chapter 16, which is the concept of nutrition, and chapter 19, which is the concept of gas exchange. These are the learning objectives, so make sure you review those and understand these objectives as it relates to the concepts, and hopefully you have a better grasp by the end of this presentation. So the first concept that we're going to talk about is the concept of development. And just remember that this is mostly, it involves pediatrics as well. I know week 2, module 2, we spoke about the maternal, but this concept will mostly talk about the pediatric population. So you do have to, have a basic developmental skills and understanding of pediatric information. There is a link regarding the NCLEX blueprint on just pediatric information. And then there's also the pediatric website where you can review each developmental stage, and then the theories that are involved with that by Piaget, Erikson, and Kohlberg's moral reasoning development. They don't really talk much about Freud's psychosocial development, but we'll touch on it a little bit. If you want to know more information, you can refer to your ATI book, or there's other links on the web as well. So email me if you want more information regarding Freud's psychosexual development, and I will be more than happy to send you more information on that. So the definition is on the first part of the slide. So then we have physical growth, which is, remember, a quantitative change in which an increase in cell number and size results in an increased overall size or weight of the body or any of its parts. So that is the definition of development. You do need to know the major difference is the process by which is initially form cells and structures that become specialized. And then again, remember that this is both a quantitative and qualitative change from simple to complex, in which the broad global function becomes refined in specific maturization, which is the emergent of personal behavioral or adult-like physical characteristics, or ripening. There's a table that you can refer to, table 1.1, for the correlation of development versus chronological age, and there's also figure 1.2 for the 6 overarching domains in that chapter. The accelerated and decelerated pieces of development occurs somewhat independently within each domain. The physical and psychological, which is the motor, the social, cognitive, and communication. For example, while gross motor skills are changing, like the infant will start walking, will develop language skills, may not be developing as quickly as other people, but remember, it's still being developed. So as nurses, we will plot growth and height and weight and head circumference on a chart for infants, along with their developmental milestones, such as motor development, language development, and social emotional development. And then we have those other Freud psychosexual development, and then Erikson's psychosocial development, and then we have Piaget's theory of cognitive development, and finally Kohlberg's moral development. And those are the ones that you need to know for the NCLEX risk recognition. Prenatally, we do have to assess risk during birth, right? The risk that the individual will pose, family risk, situational risk, depending on the social determinants of health, toxic stress, and health status. There are further notes that are posted under Blackboard under this module that are specific to development. And then there's the Denver developmental screening tool that you will have to do during your discussion post. So hoping that can all address the different developmental stages. Okay, here is the question that you should answer on this chapter. The next chapter is the concept of family dynamics. And as I mentioned before, it specifically is focusing on family systems theory, which allows the nurse to view the family as a unit and thus focus on observing the interaction among family members and between the family and the illness or problem, rather than studying family members individually. The following are key characteristics of family systems theory. A family system is part of a larger super system, which is composed of many subsystems that the family is composed as a whole, which is greater than the sum of its individual members, right? A change in one family member affects all family members. The family is able to create a balance between change and stability, and family members, they will show, different behaviors. And those behaviors are best understood from a view of circular rather than linear casualties. Because a change in one family member affects all family members, a change in family dynamics will occur. The family is a social system. Family members have specific roles, such as, the father role, the mother role, the daughter or son role, but it all maintains, they all do it maintaining equilibrium between the complementary roles, which is accomplished through family dynamics, and then the focus of the family stress theory is on the way, how families react to stress. So stress of families can be studied in the context in which the family is living both internal and external events that the family can change it, or maybe control, such as family structure, which is part of the physiological defense, or maybe they have philosophical values and beliefs that compromise the internal contacts. The internal and external contacts is composed of the time and place in which a family finds itself in, over which the family has no control, such as the culture or or religion of the larger society families that pass through the stages. But most importantly, during this family dynamic concept, relationships among family members move through transitions. And although families have roles and functions, you have to think of the family's main value is in relationships that are irreplaceable, right? And those developmental stressors can disrupt the life cycle process. So all of those will affect family dynamics. And here is the question regarding family dynamics. Okay, and the concept of nutrition. So there's more information posted on the concept of nutrition on the Blackboard site under Module 5. So the definition of nutrition is a science of optimal cellular metabolism and its impact on health and disease. So it entails carbs, proteins, and fats. They are all considered macronutrients at the macro level because they are energy sources, while vitamins and minerals are micronutrients because there's a smaller need for these requirements, including those trace minerals, which you probably heard of the phytochemicals, which is a term that refers to plant compounds that have antimicrobial, antioxidants properties, and anti-inflammatory properties, along with immune boosting properties as well. So significant changes in growth and development will occur in the first year of life. The birth weight triples. The length increases by an average of 50% in infants. So just remember, infants have very different nutrient needs compared to adults to support this rapid growth due to the lack of teeth. Infants don't have teeth or chewing capability. They have an immature GI tract, and nutritional intake of infants should be limited to breast milk or formula, which is a problem right now in the US, right? There's a formula shortage. And also water for the first 6 months of life. The newborn infants depend on all of those. And on the physical and motor skills, remember that the newborns need a strong suck swallow reflex for adequate nutritional intake to take place. So as a child's GI tract develops, solid foods that do not require chewing can be gradually introduced, ideally starting at about 6 months of age. As the teeth are starting to emerge, the older infant and young child can be offered foods with various textures. Significant changes in nutrition will occur during pregnancy and lactation to account for the body composition changes that are happening during pregnancy, such as hormonal, metabolic, and anatomic changes. And just remember, the growing fetus before birth and production of breast milk after delivery increases are required for the mom to intake, additional carbohydrates, proteins, fats, and then most micronutrients are recommended with this phase as well. So when we're talking about the secondary screenings, primary screenings is using the MyPlate website, which is posted under myplate.gov. On the slide here, choose myplate.gov. And secondary prevention is screening such as, blood draws, so lipid profiles, albumin, prealbumin levels, and hemoglobin A1C levels as well. So here's the concept of nutrition, question 3. And finally, we're going to talk about, we're going to discuss the concept of gas exchange. So the definition of gas exchange is the interaction between the neurologic, cardiovascular, and respiratory system, where the lungs deliver oxygen to the pulmonary capillaries, where it ties to the hemoglobin molecules to the cells after cellular metabolism occurs. Then CO2 is carried in hemoglobin to the lungs and it's exhaled. Ischemia is insufficient flow of oxygenated blood to tissues that may result in hypoxia and subsequent cell injury or death. Hypoxia is insufficient oxygen reaching the cells, whereas anoxia is the total lack of oxygen in body tissues. And hypoxemia is reduced oxygenation of arterial blood ventilation problems, such as inadequate bone, muscle, or it's inadequate in the bone, muscle, or nerve function to move air into the lungs. Can also be a problem, such as if your patient has a rib fracture, right? It will reduce inhalation due to pain, muscle weakness that prevents the full thoracic expansion, or maybe your patient sustained a cervical spine cord injury, a spinal cord injury that limits movement of the diaphragm, causing other issues. Then there's narrowed airways from bronchial constriction, such as asthma, or from other obstructions such as chronic bronchitis or cystic fibrosis. These can all impair gas exchange or gas diffusion in the alveoli. And other diseases that can occur is pulmonary edema, acute respiratory distress syndrome, or pneumonia. There's issues also with transportation, which refers to the availability of hemoglobin and its ability to carry oxygen from the alveoli to the cells for metabolism, and to carry CO2 produced by cellular metabolism from cells to the alveoli to be eliminated. There's an transport of action that can occur when, because it's altered, when an insufficient number of quality of erythrocytes exist to become available to carry the oxygen, or when the amount of hemoglobin in blood is low. This occurs when the patient can have anemia for any reason. And then perfusion refers to the ability of blood to transport oxygen containing hemoglobin to the cells and return carbon dioxide containing hemoglobin to the alveoli, which can provide inadequate impaired perfusion. This can be caused by causing decreased cardiac output, as well as maybe a thrombi or emboli exists, which in turn can cause vessel narrowing. So the blood vessel can narrow, causing vasoconstriction or even blood loss. Okay, I know, a mouthful, right? So those are the lab tests that they can do. And then question 4 is a question on concept of gas exchange. And then these are the learning objectives. All right, thank you.